The Canadian Club of Halton is celebrating their 40th season this year. Jessica Kaitting attended their latest dinner event where the CEO and co-founder of the Brainwell Institute discussed dementia care in Canada and their efforts to close the gap between diagnosis and meaningful care.
A couple of months ago, we released a report called Mind the Gap. And the whole point of it was to take a really close look at dementia, which is a condition that has cognitive memory loss that continues over time until the person can't take care of themselves anymore. And we wanted to take a closer look and understand what are the big gaps and how can we fix or produce solutions that would make a difference. So there were three main highlights out of that. The first is that when Canada decides it wants to build something, especially something that's supporting Canadians, people living with a condition, we can. So there's always good learnings there. The second is that we heard directly from patients, people living with dementia, that their number one issue is they cannot navigate the system. It's like walking through a maze. There's all these gaps and they have to figure it out for themselves. And so if there's one thing that could be solved that would make a big difference to care overall, it's coordinating that care. And the third piece is that we've already done things like that in Canada before. We've done it for cancer, we've done it for stroke, we've done it for mental health, and these are all very complex conditions, which means it's possible to do for dementia as well.
For those who are concerned that they are starting to experience symptoms of Alzheimer's or other forms of dementia, Dr. Sivananthan gave this advice.
The first key advice is that if you haven't gotten a diagnosis yet, but you're worried about it, I understand. There's a lot of fear and stigma around this condition, but the sooner that you can get a diagnosis, the sooner that you know what you're dealing with, first of all, because sometimes it might not even be dementia. It might be some other condition that's causing those symptoms. But the second is if you have been diagnosed with dementia, you want to be able to start planning early. And so there are a couple of things to plan around. First, sit down and write down what is most important to you. Because with this condition, you're talking on average 8 to 10 years. That's a long time to live with it. So what would a purposeful life look like for you, the things that you want to accomplish? And then start putting those pieces in place so that you can get the support you need. So things like financial planning, getting a power of attorney in place for legal planning, and having those really hard conversations with a family member or someone who is able to support you as a caregiver. Because that is the number one thing when it comes to dementia. Having a caregiver there to work and support the person living with dementia means better outcomes overall. And the last piece is most people don't realize this, but rehabilitation, getting access to things like OT, PT, speech therapy, physical therapy early can be really helpful in supporting a person as they deal with the condition. So consider that as an option as well.
To learn more and read the full Mind the Gap report, visit brainwellinstitute.org. For Halton News, I'm Jessica Kaitting.